everybody. We are still in this place and time when we need an hour towards CDT certification on regulatory standards. It's been quite some time since we really focused on infection control and blood-borne pathogens. You know, this was started sometime back in the late 80s. And that's all we did was talk about this in the beginning. Now it's kind of normal for everybody to go through these procedures, but we do have a lot of new individuals that are coming along in dental technology and also as dental assistants who don't have formal education and need some kind of a background or at least a start in what does it mean to do infection control and what does it mean to have these issues that we have to take a look at that maybe they haven't talked about before or even worried about. So let's begin this. This is what we're going to cover today. We're going to talk about some definitions. I know sometimes that's a little boring, but I want you to understand what the terms are. We're going to talk about some common pathogens. We're going to talk about universal precautions. This is something you'll hear about all the time, universal precautions. Clinical and laboratory precautions that we need to do. Then we're going to talk about clinic to lab to clinic transportation, because many times it breaks down in there. And then we want to be sure we understand the difference, between disinfecting and sterilizing. Okay, so let's launch right into this. First of all, this whole thing about infection control, it sort of acts like a game, but it's not. It's not tag your it. It's a real dangerous thing. We recognize that. We have immune complications in a lot of people, and we're doing our best, I think, as a society to try and prevent some of those issues when these pathogens get out there. So let's be a little forward acting, and we're going to talk about it. So what is infection control? I really like this slide because it's a couple people just shaking hands, but you see all the buggy critters that are all over there. And I want you to remember this picture as we go through the slides here this morning. Okay, first of all, when you see this symbol, this means that the materials inside this product, this bag, this whatever it happens to be, are a biohazard, and they need to be treated specifically as a biohazard. We can't just lay them around on the kitchen counter or in the break room or in any other area where they might be transmitted to other people. We've got to take care of them. And so pay attention when you see these symbols, especially this one. It might show up in different colors. I like the red one just because I'm old school and red always meant stop. But that's, you know, my day and age. So if you're red, green, colorblind, I apologize. It just looks gray to you, but that's why there's words at the bottom that also say biohazard. Okay, so from Wikipedia, let's define infection control, okay? This is the discipline concerned with preventing nosocomial, nosocomial or healthcare associated infection. That means I got it at the doctor's office or in the dental laboratory or in the dentist's surgical suite, wherever it was healthcare associated. It wasn't outside in the environment. This is a practical rather than academic subdiscipline of epidemiology. It is essential, though often under-recognized and under-supported, part of the infrastructure of healthcare. Infection control and hospital epidemiology are akin to public health practice, practiced within the confines of a particular healthcare delivery system rather than directed at society as a whole. Okay? There are anti-infective agents. They include antibiotics, antibacterials, antifungals, antivirals, and antiprotozoals. We're going to talk a little bit further about that. Now, it addresses factors related to the spread of infections within the healthcare setting. Okay, that's patient to patient, patient to staff, staff to patient, or just among the staff, including prevention. And we're talking hand hygiene, hand washing, cleaning, disinfection, sterilization, vaccination, surveillance, monitoring, investigation of, demonstrated or suspected spread of infection within a particular healthcare setting. That means we're going to surveil and outbreak investigate things that go on, and the management, meaning we're going to interrupt those outbreaks. It's on this basis that the common title being adopted within healthcare is infection prevention and control. So when you hear that referred to in seminars or literature, whatever that happens to be, they're talking about the healthcare setting. Okay. Now, where do I find the regulations? And I'm giving you this information not so that you'll remember it. Who remembers where to find regulations? But I want you to be able to go back if you need to and say, I saw that someplace and here's where it is. So the United States, currently the federal regulation that describes infection control standards is found at 29 CFR Part 1910.1030 Blood Bourne Pathogens. Okay, that's where you can find it if you need to. Now, we mentioned the word epidemiology, so let's talk about that for the moment. Epidemiology is the study, okay, remember ology is the study of, scientific, systematic, and data-driven of the distribution, which is the frequency or pattern that something takes place, and determinants, meaning the causes or the risk factors involved, of health-related states and events, not just the disease, but issues that cause it, in specified populations. Okay, so we can be specific. We can look at, for example, a certain dental laboratory, a certain dental practice, a certain school among those children, a certain whatever that happens to be. It's also the application of this study to the control of health problems. Okay, now the Center for Disease Control is populated by a whole lot of epidemiologists. They're the ones that study all of this and give us some answers about what's going on within our country, within other countries, so that we can track these problems. Now, something is bloodborne. That means it's capable of being carried or transported in blood, right? So it's not something that you breathe out onto somebody. It's not floating about in the air. It's something that's actually in the fluid, and especially in blood, where it's being transferred. Now, a pathogen, we talked about that. A pathogen, it has some Greek definitions up here, but it's a germ. I mean, that's what it is. It's a bug, we would want to call it. In the oldest and broadest sense, it's anything that can produce a disease. So here we are. It can be one of several things, though. If we look down at the bottom here, the term is used to describe an infectious agent like a virus, bacterium, protozoa, which if you're not familiar with that is a little single-celled goofy critter, prion, and a fungus, or other microorganisms that we're not totally aware of. Okay, that is called a pathogen, and the study of that would be pathology. Okay, now an infection is when somebody, a person, an individual, an animal, a plant, doesn't matter what it is, but it gets invaded by disease-causing agents. And so we all know what that infection is. We've all had infections before, whether it's we had a torn fingernail, we had a cut that got infected, we had something. We know what happens there. The body tries to fight it, all kinds of icky stuff happens. And so we know what an infection is, and we want to stay away from infections. Now, infectious disease is also known as a transmissible disease, meaning that it doesn't just stay right where, for example, if I had a cut on my hand and I had an infection there, it wouldn't just stay there. I could transfer that to somebody else who might also have some kind of a cut or an opening, whatever that happens to be. So I need to protect myself and get rid of the infectious agent, but I also need to help protect others by not passing this thing around. Okay, when you pass that around, this kind of a transmissible disease is also called a communicable disease. It's an illness that results from an infection, but is one that doesn't just stay within the individual host, person who has it. Person who has it can also transmit it to somebody else. Okay, disinfection is to cleanse or clean whatever it happens to be of the infection and destroy the disease germs. That's disinfection. Okay. You'll notice sterilization has a larger definition, but let's just see that we'll say that this not only eliminates it, but it kills it. It deactivates all forms of life and other biological agents present in a specified region or surface. Okay, so you can see if I'm just wiping a countertop down, that might disinfect something, but it doesn't necessarily sterilize it. I would have to make sure that any bugs, germs, whatever, microorganisms on there were absolutely dead, which means that I've got to generally take it up in temperature to the point where nothing biological can live, or I have to attack it chemically so that nothing biological lives. Okay, it must kill it, deactivate it, or eliminate it. So that's sterilization. Now, there's different substances that we use, of course. Antibiotics, everybody's familiar with those, right? Antibacterials, antivirals, antifungals, and antiprotozoals. So if we get rid of the anti part and we recognize that if we need to determine what the thing is that we're trying to attack and kill. Is it a bacteria? Is it a virus? Is it a fungus? Is it a single-celled critter that's floating about? Protozoa, okay? We've got to be able to do that, which is why there are epidemiologists who can study those things and let us know what's going on with them, okay? And we're real familiar with doing a lot of things. A lot of us, we get a cut, we throw on what we call a triple ointment, right? Which is an antibacterial, antifungal, it's all those things mixed into one to help kill whatever germs might be around and help us heal. Okay, so we're going to do that also in the laboratory and in the clinic on a larger scale. It's not just going to be putting a little bit of goop on our finger because we got a cut, although we are going to do that. We don't ignore those in any of those situations. We are going to also take care of all the rest of the area and space in which we occupy. All right, so good question. Where do pathogens come from? And honestly, the answer to that question is this. They're everywhere. I like this little slide. Bugs. Bugs are everywhere. And they are. This entire world is full of all kinds of bugs. Some of them are good and perform good service to us, but they could also be bad for us if they happen to get into certain parts of us. So it's not that all bugs are bad, but we have to make certain in certain areas that we aren't dealing with bugs and surgical procedures, for example. Other kinds of things that we don't want to get those bugs involved with. And so we've got to be careful and recognize that they're everywhere. We're always surrounded by them, but we need to also be careful and control where they are. They come from the earth. Different populations of people transmit different things. Animals certainly do. Plants can have those kinds of issues with people, and so do microorganisms. For example, we were out the other day pulling weeds in the yard and ran across a whole patch of poison ivy. Now, not everyone has poison ivy. Some of you have poison oak. Some of you have poison sumac. Some of you have all kinds of other plants that create this kind of allergic reaction in people, right? Some react more than others do. Some, you get that on you and it requires immediate attention. Others, it's just wash it off and it's no big deal. But we know that those kinds of entities are everywhere around us. And as an individual, we need to be aware of them. Okay, our job though, in this healthcare environment in which we work, is to create an environment where we don't bring pathogens in, we don't expose others to pathogens, we keep our patients from exposing us, we keep our patients from exposing others who might come in, we don't transfer pathogens out of our physical facility if we know they're there, and we do our best to destroy the pathogens on transferred materials. So we are involved in the business of containing whatever pathogens might be in our own particular zone, whether that's the dental laboratory, whether that's the clinical office, it might be in a surgical suite, it might be, in the lab back where you're polishing dentures. Whatever it happens to be, it's our job to kill all that stuff and make sure it's not transferred anywhere else outside of where we are. Okay. Now, these are our largest offenders right now. Hepatitis B is a big one. It gets transferred around a lot. Hepatitis A has a little bit of a resurgence lately. I know here in Louisville, we've had quite a bit of it. That's popped up, generally associated with the food industry, and has to do with really not good cleanliness on the parts of human beings, not establishments necessarily. Hepatitis C is also another big one. HIV, we still are talking about that, the human immunodeficiency virus, which can then eventually cause AIDS. And then general bacteria, which is everywhere. That's stuff you find because you didn't clean your shower right. You've got maybe some mold, some bacteria growing in there that you need to get that cleaned out. Just normal kinds of things like those. Those are the largest offenders that we run into. Okay, now Hep A is a virus. It is highly contagious. It infects the liver. It's rare. According to this study, there's fewer than 1,000 cases a year in the US. It is transmitted, and you're going to love this, through the fecal oral route, which means somebody went to the bathroom, didn't wash their hands, transferred it somehow to the next person. Okay, it's gross, and we can take care of that. It doesn't take a lot to fix that. It's preventable by vaccination. So if you're in the healthcare industry, we certainly would suggest that you get vaccinated for hepatitis A. All right, hepatitis B does basically the same kind of stuff. It attacks the liver again. About 20,000 cases in the year. It's transmitted through direct contact, people-to-people contact. It also can be prevented by vaccine, a couple of different types of vaccinations that are out there. If you are working in the healthcare industry, really, hepatitis A vaccine, hepatitis B should be offered to you by your employer if you've not had it. If you already have had those vaccines, then your employer should be notified that you have had them. Okay, should be just part of that because you're in close contact in an area where this transmission is possible. There is no known cure. There are treatments. You can wind up with Hep B and it stays there your entire life. So we want to make sure you don't get it in the first place. How is it spread? Exposure to the virus by blood. So it's bloodborne, semen, saliva, vaginal fluids. The virus is transmitted through unsafe sexual practices. It can be transmitted from an infected mother to a child in utero. And there are all kinds of bad news symptoms that make you feel like awful. So it's all about really hygiene and just doing all the things that mom and dad told you to do in the beginning of life, okay? It really is. And if you're not doing them, we need to begin doing them. And so do all those around us. And that's why actually this webinar is going to be great for use later in the laboratory or as a lunch and learn in the office, something like that, so that you can all be reminded about what we should be doing. Hepatitis C also causes inflammation of the liver. It's pretty common, 200,000 cases a year in the US. It's a blood-borne pathogen. and can last several months or years. It can be treated. Most of the people won't show symptoms of this. They experience a mild illness, okay, kind of flu-like actually. There are medicines out there. So if you're feeling that kind of stuff, whenever you feel this way, if you're involved in dentistry, if you're involved in the laboratory end or the clinical side, you really, when you're feeling cruddy like this, and you're not sure if it's a cold or if it's the flu, you really do need to be seen by a doctor. And they need to know that you work in the healthcare industry so that they can check for these kinds of problems with hepatitis. Okay, then there's HIV/AIDS. There's been a lot of discussion of this and how it's transmitted and what happens with it. 200,000 cases a year. It is blood-borne. You can be treated for it. It can last several years. It also, in the beginning, will feel flu-like. There are no cure. There are no cures for HIV/AIDS. Antiviral medications can be given to help control it, but once you have it, you have it. And so those whom you are intimate with need to know. To keep that information from them is really tragic and illegal in most cases because you're dealing with a blood-borne pathogen and you might transmit it to them. So you have to be very, very cautious about what you're doing if you are an HIV/AIDS patient. Now, we do have also laws in place that don't let us shout from the rooftops who is an HIV patient. On the other hand, it's incumbent upon the patient themselves to be wise about what they're doing and what this represents to other people. All right, now common bacteria is it's a type of a biological cell. They're typically little tiny, just micrometers in length. They have all kinds of different shapes and they do all sorts of stuff. They've been around forever since the earth was formed. They inhabit the soil, the water, you name it. We can find bacteria growing almost everywhere. And you want to try to free yourself from as much as you possibly can. Although we know there are good bacteria too. So it's kind of a constant battle that we face with bacteria. We just don't want it to get out of control. All right, now let's talk about the 6 links in chain of transmission of infection. And we'll start up here at the very top. There's an infectious agent of some type, okay, one of these pathogens. It exists in some kind of a reservoir. In other words, there's a place where it can live and replicate and continue to exist where it's not in danger. Then at some point, there's a place where that pathogen gets out of the reservoir. That's your portal of exit. And then there has to be some kind of means of transmission. Now, that would be, for example, we're talking about blood-borne pathogens. That would be, it's in the blood. It exits because, well, let's say you're in the dental chair, you're being probed around and scraped upon, and you nick your gums and you start bleeding, and now that's the exit, okay? The means of transmission is the blood that's now running in your mouth. In order for it to get into another person, there has to be a portal of entry. Now, that would be somebody who doesn't have gloves on, who has a cut on their finger and picks it up that way. Or maybe you were given an injection and then the individual who gave the injection or someone else on staff pokes themselves with a needle. That's your portal of entry, okay? You must have a susceptible host. That means someone who doesn't have some kind of antibody in them to kill this bug. And that could be a person who was not vaccinated, okay? And now the infectious agent has a new place to be in a new reservoir, and it's been transmitted. And it goes round and round and round and round from person to person. So anywhere we can stop the mode of transmission, anywhere that we can stop that, we've provided a service not only for ourselves, but for other patients. Okay, so in the clinic, where can we find this? Well, patient blood and saliva. Unfortunately, lavatory transfers, that's not sitting on toilet seats. That's just not being clean about what you're doing afterwards. Okay. Aerosols. Aerosols are created by using high-speed and low-speed handpieces in the mouth. It picks this stuff up in the mouth, creates an aerosol, it gets out in the air. Comes out of the patient's mouth, and it's out in the air. Impression materials that you take. You take an impression after you've done a preparation on somebody, or you've done a cleaning or something, they're bleeding, you take the impression, blood's on the impression material. Any kind of sharps, that's scalpels, needles, instruments, okay? All those things can create cuts and pull infectious material with them. Retraction cords that are jammed down in the sulcus. Once they're pulled, they usually have blood and goop and all kinds of stuff on them. That's an infectious agent there, okay? Instrumentation, of course, we talked about some of that. In the clinic, other personnel that are bringing these pathogens in with them to work, okay? That can happen too. Now, when they do that, there's two kinds of folks that do that. One that intentionally comes knowing they have it, and one that has no idea. And we can't treat both of them the same. So in terms of blame, if you would, if that's a good way to put it. But we can treat them both the same under something else called Universal Precautions, which we'll get to. Now, how about the laboratory? Well, blood and saliva in the lab. Now, you'd say, where does that come from? Comes from the doctor's office. Comes from other people in the laboratory. Laboratory technicians get cut all the time. And so there is blood and a lot of times saliva hanging around. So same thing. We've got to be careful of that. Lavatory transfers are everywhere. That's the same problem, and it has to do with unsanitary practices in the restroom. Impressions come in from the doctors that have blood and saliva on them. Sharps in the lab, like I said, laboratory personnel get cut all the time. Retraction cords often come in along with, they weren't pulled before the impression was taken. They were taken the impression was taken with retraction cord in place, was picked up by the impression material, and now it's at the laboratory. Aerosols, once again, created by high and low speed hand pieces. That would be grinding on models that are infected or other materials, contaminated stone models, and then, of course, other personnel. So there's some common similarities between the clinical side of our world and the laboratory side of our world, and both of them need to be treated the same. Okay, so let's talk about this thing called Universal Precautions. You've heard that mentioned 100 times, but let's just say that this definition is a really good one. Observing universal precautions means you consider all human blood and certain human fluids infectious for all blood-borne pathogens. And since all humans have blood and human fluids, then you have to assume that everybody is infected. That's universal precautions. So you take precautions against everyone. You can't make the assumption that somebody has no pathogens. It just doesn't work. So let's talk about what we can do in that. What does that mean? Once again, you assume everyone you come in contact with has a blood-borne pathogen. You protect yourself and you protect others. Now, how do we do this? Because that's important. Okay, first line of defense is you wash your hands. You wash your hands coming out of the bathroom. You wash your hands in between patients. You wash your hands, wash your hands, wash your hands. That's the first thing. It is the biggest thing. There are populations of people where they've introduced hand washing and disease has dropped dramatically with no other reduction in anything else. It simply works. It's the biggest place that we transfer disease is from our hands. So this is a great little slide. This tells you exactly how you should be in 7 simple steps washing your hands. Palm to palm, palm to fingers, palm to back of hand, thumbs, clasp, fingertips, okay? It tells you exactly how you should do it. And if you're not doing it that way, then you're not getting everything clean, and you should be. Doesn't take that much time. This is the first line of defense in any kind of blood-borne pathogen safety. Hand sanitizers. Now, you can use hand sanitizers, but they should be secondary. They shouldn't be the thing you rely on all the time. Hand sanitizers come in different kinds of materials. The one that Whitmix that we sell is this preference hand sanitizer, which is an alcohol base. Works very well. And the other thing about it is that you can slide your gloves on real easily after you use it. Sometimes the others are a little too sticky and tacky. But you can keep this material around you and use it in between. There's nothing wrong with that. It'll kill, at least preference will, about 99.9% of most common germs, okay? Dries really fast. It's great material. Hand sanitizers are good to have around. You see them all the time in hospitals now, right in front of the elevators, which is a good place. I was just visiting somebody. Now I'm coming out of the hospital room. Do I have anything on my hands? Well, I don't really know. Hand sanitizer. Good way to do it. You can run it on the run. It's also something you can drop, ladies, in your purse, gentlemen, in whatever you're carrying, and your backpack. That's a good place for it. So you can clean up on the go even when you don't have water. But you can't just rely on this. Hand washing is still the first and best deal. Now there's the use of personal protective equipment. And the very first personal protective equipment that we use is gloves. In the clinical setting, constantly using gloves when you're touching the patient or patient materials. When you have inbound materials at the laboratory, gloves. It's the first best thing to keep yourself, or to have, I should say, a barrier between you and an object or a patient. Okay. Next thing are aprons, gowns, protective eyewear, face shields, masks. All of this personal protective equipment will apply depending upon what procedure you're doing in the laboratory or in the operatory. Certainly in the operatory, if you're in there and doctor's preparing a tooth, you're going to want to have on a mask of some kind, right, to prevent you from healing what is now become inhaling, what has now become an aerosol. You're going to want to have on protective eyewear. And by the way, so should your patient. You don't worry too much about what they inhale because it's already in them, but you should be concerned about it. Now, in a surgical setting, you're going to want to go into gowns, probably face shields, other kinds of things. But it just depends upon what the regulations are for your particular area. And then just think smartly, okay? What am I going to be exposed to here? And use the proper equipment. All right, now, when it comes to sharps, when I say sharps, I mean anything that's capable of poking or cutting you. That's in the lab or in the doctor's office. There should be sharps containers wherever you are, so that you can place your sharps inside that container. Those of you who are around syringes, please remember that you should not be trying to recap the syringe. That's where a lot of those pokes take place. In the laboratory, it's always that Bard Parker scalpel blade that gets you. It's that last little, not the front end usually, it's the little piece near the back of the blade that's also sharp. That can be taken care of by just using a rubber wheel and getting rid of the sharpness back there before you use it. But when you're finished, those blades all should go in a sharps container. Now, if you don't have an official sharps container, you can always make one. And there are steps here that show you how to do it, but it's something that is non-permeable, okay, and that you can throw those sharps in and then have them disposed of by a sharps disposal person. Make sure you're using those sharps containers. All right, cuts and wounds is the biggest modality of transfer. Needle sticks, blade cuts, rotary burr cuts. That's when, you know, you're running that handpiece and ouch, you slip and get you. Abrasions, that's scrapes and bruises, sores for any reason. They all constitute a possible infection site. If they occur at the lab or the clinic, they should be reported, okay? If you're in the doctor's office, you report to the doctor that this happened. If you're in the laboratory, report to the laboratory manager that this happened so that they can keep appropriate records, and you should be treated according to universal standard precautions. Okay. If you brought them to the lab or clinic, they need to be treated and covered, any of these things. Okay. So if you got cut working on the weekend and you come in and now you're going to go to work at the office, you need to have gloves on. In the lab, finger cuts work sometimes better than gloves. Whatever it is, they need to be covered, band-aided. You need to be protected, okay, so that you don't pick up something else. Here's the clinic, of course. In the clinic, we use a lot of surface barriers. You'll see these all around now, plastic on all kinds of things. That's because you're working in the patient, and then you have to reach up and adjust the light. You just took your hand, that's, even though it's gloved, you took your hand with the goopy stuff on the glove and just stuck it on the light. So whenever you have any areas where it might be easy to transfer, we can use surface barrier materials like this. Okay, there's clinical cleaning, contact surfaces, and you can see there's several of them here. If you can see my little pointer there. Lights, door handles, trays, of course, countertops, the chair itself, lots of places that can constitute contact surfaces where the material will stay and can be transferred to someone else touching it. Housekeeping surfaces, that's walls, sinks, floors, okay? All those kinds of things need to be cleaned on a regular basis. Patient care equipment, all equipment, you handle that in a manner that prevents personal skin and membrane exposure, cross-contamination, anything that you have that's reusable. We've come really to a day and age where we use a lot of disposable things, and in part that's because it's easier to use something, throw it away, and contain the pathogen than it is to use something and then try and kill the pathogen before used on another patient. We still have a few of those things. Needs to be disinfected, cleaned, reprocessed, if it can be sterilized. Okay. Impressions. Now this is a really good example of an impression. We see these at the laboratory all the time. These should never leave the doctor's office in this condition ever. It's generally the dental assistant's responsibility to get this stuff packaged up and sent to the lab. And if you, as a dental assistant, are leaving blood on the impression like this, you're making a mistake. This should be, first of all, disinfected, second of all, cleaned before it gets sent to the laboratory. In many states and regions, that's actually against the law to let a blood-borne pathogen or an infectious agent out of your office, okay? And if you're sending blood like this out without it being disinfected first or cleaned, then you're breaking the law. There should be a separation or a barrier between pieces of the case that you're sending out. Face bows, bite forks, impressions, bite registrations, paperwork especially, photos, any of that stuff, you need to contain it in some fashion. Don't just take it all and throw it in a bag or take it all and throw it in a delivery box. That just cross-contaminates everything that's in there. Don't reuse soiled cases or bags. They're single-use items. They just are. Throw them out. Now, as a person who's in the doctor's office, clinical setting, you need to let the laboratory know what your disinfection process is, because you're sending a product to them. They don't know what you used, and so it makes it difficult for them to use a disinfectant. Under Universal Precautions, they have to assume that you did not disinfect. Even if you did, they must re-disinfect. So we want to make sure that we're using products that are similar and aren't going to cause other chemical reactions that are there. Now, in the laboratory, first thing first, everybody handling inbound cases should have some kind of personal protective equipment. That includes masks, that includes eyewear, and it should include gowns, because they're going to be handling this, perhaps washing something off a sink where things could splash. They should have all of that when it's inbound materials. Okay, here you go, lab guys. Do not assume the doctor's staff disinfected. There have been many, many times when they don't. Assume all pieces of the case are infected. Clinical staff should inform you of their process. Insist upon separation of the case and the paperwork. Sometimes we see the prescription just stuffed in there and it's laying right underneath that bloody impression that came in. Now the paperwork's infected. We can't be doing that, so insist on that. Note when disinfection has not taken place at the clinic and let the doctor know. Okay, dental assistants, we're not trying to get you in trouble. We're just trying to make sure that we don't move blood-borne pathogens and other bugs around. It's that important to all of us, okay? And then lab guys, when you send things back to the clinical setting, make sure that they're disinfected and make sure doctor knows they're disinfected, okay? We don't want that denture coming straight from the pumice bin and the polish area without it being cleaned thoroughly and disinfected, because bacteria grows in pumice. We all know it. We don't want to pass that around either. Okay, disinfect your instrumentation in the lab, any of the surfaces in the lab. And we've got a lot of surfaces, just like the clinical office does. Make sure they get disinfected on a regular basis. Okay, try using unit dose concept, which is just using a single, for example, here's some pumice over here on the right-hand side. We're going to polish the appliance, and then we're going to take and we're going to throw all that pumice away, because we have to assume that the denture that came in for a reline or repair has bacteria on it. And now when you polish it, transfer it into the pumice. And then if you use that same pumice to polish somebody else's case, you can transfer the bacteria right back onto that case. So try using this. It refers to dispensing just a smaller amount of material, sufficient to accomplish the job, and then getting rid of it once you're completed. Okay. Personal hygiene in the laboratory. This is often problematic. Not so much in the clinic because you're in a different situation. But lab guys live at the bench, and I apologize for calling you lab guys. Dental technicians live at the bench, so you need to refrain from these things: eating at the bench, drinking at the bench, smoking at the bench, putting on cosmetics or lip balm, handling your contacts. I know right about now somebody's eye is itching. Okay, you need to be aware of those things. Just don't do it. This should be a clean environment, and when you need to do any of these other things, you should take off and go do them in a separate place where you know it's clean. Okay. Now, let's talk about disinfection versus sterilization. We defined it earlier on, but let's really take a look at it. Chemical disinfectants have two functions. They have to be an effective antimicrobial agent. They must not adversely affect the dimensional accuracy or surface texture of impressions, materials, or having problems with the gypsum that we pour. Okay, now there are lots of them that are out on the market, and I'm not going to promote any particular one, but you should take a look at them. I think we've gone through from the beginning when we started to use things, we had some problems with dimensional accuracy, and I think we pretty much have solved that with all of the disinfectants that are out there. Just understand that there are different types. All your employees in the laboratory and in the clinic should be properly trained to handle the materials in accordance with OSHA and hazard communications. So disinfectant must have Environmental Protection Agency registration number, whatever you're using. So don't pick up, Clorox wipes necessarily to use around your office and call it okay. Make sure that you've got EPA registration numbers. I use Clorox wipes just as an example, okay? It must be at least an intermediate level activity. It means it has to be tuberculocidal and hospital grade to be used in our healthcare environment, okay? We're not talking about home. We're talking about here. We've got to use the proper material. All right, disinfection. Prosthodontic items contaminated by handling should be disinfected either by spray or immersion in the chemical, and the technique is based on whatever you're using. So here's some example of things that we use alcohol torches, face bows, articulators, mixing spatulas, mixing bowls, lab knives, and the shade guide, the mold guide. And by the way, if you've been disinfecting your shade guide for a long time, it probably is not the right color anymore. And if you're having problems in communication between the office, the dental office, and the laboratory, you might want to check and make sure your shade guides A2 really does look like A2 on both of your sides of the world. Then there's sterilization. Heat sterilize all metal and heat stable instruments that contact oral tissues, contaminated appliances, or potentially contaminated appliances. So what could that be? Well, you can't put the whole face bow inside and do that. They're made out of dissimilar materials, but you can take the face bow fork off. Any metal impression trays, burrs, polishing points, rag wheels, lab knives, all of those can go into the sterilization unit and be sterilized. And you should be aware of that and be doing that in your office. Okay, so the best safeguards: adherence to standard precautions at all times. Hepatitis B vaccine, right? Hepatitis A vaccine, which is available now, using aseptic techniques. That means you're cleaning things thoroughly and taking care of that. Disinfection, the use of personal protective equipment, okay? Unit dosing of materials and barriers on things, and then the appropriate sterilization and disinfection procedures for the materials that you are either sterilizing or disinfecting. Okay. All right. All of these activities are designed to accomplish one goal, and that's to break the link in the chain of infection. Okay. Whatever we can do to break that, to keep it from moving forward, helps all of us. We want to interrupt potential for person-to-person transmission of infection. That means if you know you're infected, you need to make sure that you're taking care of that. Now, I know sometimes it's embarrassing, but maybe you have to call off work because, you know, I can't bring this in. Or you're going to have to glove yourself up or do whatever you're going to have to do to protect others from you. Processes must be performed consistently and routinely to be effective. That means you have to have a procedure, and it should be written, and everybody should follow it. And most especially, it requires communication, coordinated effort between the lab and the dental office to make sure that none of these materials are escaping the lab or escaping the dental's office, going to the lab, coming back to the office. We've got to stop all that. Okay. A good reminder for you about this particular program. This is only basic information. It does not constitute certification in infection control. Okay, I want to make sure you understand that. It is good for the continuing education credits for certification in dental technology. Also, if you've taken this as a dental assistant, many of the state systems for you will allow this towards CE credits. So let us know if you're a dental assistant. We'll send you a certificate for that. You must follow your local regulations when it comes to sterilization and disinfection, and that's going to vary from state to state. There are federal standards, but there are also state and local county or community standards. You've got to follow those. So be aware of them, look for them and find them. Make sure that you have all the information at your fingertips and that you've been trained adequately. Like I said, this is only a basic information, somewhere for you to begin so that your understanding is better. All right, now some references for you. Most of the material that I got out of this came from the CDC guidelines for infection control, okay, or the United States Air Force guidelines for infection control. They have, the United States Air Force also has a dental evaluation and consultation service, and you'll see that at the bottom of some of these slides that I borrowed from them. Wikipedia, just simply for definitions, and also Focus Medica, which also gave us some other definitions for things like epidemiology and that kind of thing. Okay. All right. So thank you so much for attending this particular webinar today. I'm happy to have you with us, and hope this gives you a good start in practicing infection control and eliminating the transmission of bloodborne pathogens from the areas in which you work.